obvious that all of these issues that you all have worked on for all these years are inextricably linked. And I think AIDS has really taught us that lesson, that in the beginning we were looking at vertical programs, and we were investing so much money in trying to prevent AIDS and later to treat AIDS, and what we found at the end of the day is that if we didn't address the underlying cofactors that exacerbated the spread of disease, that it didn't matter how many billions of dollars we spent on HIV prevention and treatment, we couldn't stop the spread of the epidemic. So I want to talk a little bit, ask you all to talk a little bit about how we better integrate programs. It's so much easier for us to see an issue and invest in it. How is it that we go about not only integrating our programs, but communicating an integrated program more effectively to donors and others?
I'll hit it.
Okay.
I think one of the ways we have to do this is we have to help more folks understand, on the other end in terms of working with communities, what this looks like. And I think some of this is very simple things that we know. People don't live their lives sort of, well, here's my health piece that I have to deal with at their kitchen table, and then here's my piece over here that I have to figure out what. It's all integrated. And I think that's part of how we have to help other people think about this. The challenge, of course, at times is funding streams are siloed. And so I think figuring out how do you sort of link those funding streams and work with governments and donors to understand that. One of the ways CARE is sort of looking at this issue is in countries, we'll articulate a little more that we have sort of target populations that we're trying to help. So instead of saying sort of a whole city or a whole region, we'll say within an area we're trying to reach pastoralist women who are the herders and doing farm work in a particular area. So what are some of their challenges? And so how might we go about looking at that issue in a more holistic way and then backing it up from there? What are the needs? Are there water needs? Are there nutrition needs? Are there health needs? Is there a health system in place? What are the underlying causes that are really impacting their lives?
My husband is from Burkina Faso, but I'm from Alabama. So I say that because my experience in Africa has been very broad and throughout the world. But one of the big missing links, I think, in terms of integration is finding out what other people on the other side of the world need and want. And this has been a major factor because most of us go in with the understanding that we are the experts and we know most about what should happen, etc. And when we go in that manner, most of the times the programs don't work. I evaluated 10 programs for women with the United Nations in Burkina Faso. And I'll give you one example. There was a group of experts, and they came from America, I won't say where, and they went into an area where women were making beautiful pottery. And they said, oh, this pottery can sell. We could probably put it in some import shop in the States. And they designed a project where they would give them more money to make more pottery, et cetera, et cetera. But there was not a sit-down session in developing this protocol and proposal with the people who actually made the pottery. So in the middle of having accumulated all of this pottery, they didn't realize that at a certain period of time in the year, many rains came in this area, and the roads became unbearable, and there was no way to bring the pottery out to any kind of market. And I think that if we're going to help people, we need to start, number one, with sitting down with them and seeing what they want. One other example, working with MedShare, we had a group of women who went to Haiti, and they were great, loving women, and they went there and found that, okay, everywhere in this little area that they were helping, the women didn't have blankets to put the newborns in. So they came back, went to Kmart and all the other places and got pink and blue blankets, and they went back and they were very helpful, and the women clapped and they danced and they were happy to receive the blankets. However, at the end of the couple of days, they found 80% of the blankets in the market being sold. They came back and they were very upset. And they said, look, we're not going to help these people anymore. So I said, wait a minute. have you had any problems since you came from Haiti? They said, no. I said, maybe it was the prayers and blessings of these women who helped you to get through, because you brought them something that was commercial that gave them an opportunity to get something that they needed, which probably was food and some health care for their children. So I think in developing any partnerships, whether it's with your local church or otherwise, sit down and find out, first of all, what to integrate before you take on any project.
Just as I think about it, the other thing I think we can do is look for the hubs where multifunctions come together. We're working with a number of hospitals, for instance, in Africa, where you bring together the healthcare experts, you bring together clean water, energy, and you know, it becomes a place where not only can you then prevent disease and have an opportunity to really improve the life, but it almost forces various agencies from different silos to work together. And so I think, you know, schools, there's other places where we can look, where you've got to be able to work together in order to solve the local challenges, rather than just try to approach it with one solution.
I think one makes a difference by thinking about the issue, talking about the issue, thinking about it again, and then doing something. And it's that iterative process that at the end, maybe we're doing something differently than we thought about. Just a couple of quick examples of that. I mentioned we have a lot of graduate students interested in global health. What most of them come to do isn't what most of them leave to do. Most of them come for a particular set of motivations, but in the course of the process of teaching, it says, well, where is the disparity? Where is the burden of disease? Very few people come to work on mental health, chronic disease, you know, men's health. Those aren't issues. They come for other sets of issues, but it's talking about it, thinking about it, learning about it is the issue. How we frame issues from the North is not necessarily how they're going to be framed in the global South. I remember being very surprised in a dialogue in Calcutta focused on women's nutrition. It made absolutely no sense. You know, the woman was, you know, giving the largest share of the meal to the, you know, first her husband, then the kids, then herself. It made absolutely no sense to me. To her, it made perfect sense. You know, if he was the principal bread earner, she needed to keep him healthy. So there was another logic that you had to deal with in order to get it. Or a mother-in-law, you know, the logic of starving, you know, telling her, or a mother telling her daughter, pregnant daughter, not to eat. I said, well, gee, that's the important time. You need to eat when you're pregnant. Well, not if you're fearful of obstructed labor. You don't. You know, it's, again, that's not the reality, but the fear of it. So it's understanding some of those the other sides of the issues, and that's where I think the four issues that the Ambassador talked about today, and looking at those areas of disparity, it's, you know, and the connecting of them, whether it's health, whether it's education, economic development, political development. I think at the end of the day, it's going to be the political development. It's going to drive all of those issues, but it needs to do so with a deeper understanding of what the common outcomes of addressing those different issues will be.
You know, I spent most of my career out in the field running a lot of our development programs and humanitarian programs, and I would like to think, not always perfect, but that the idea of working with communities and listening and all that should be basic. And I'm kind of new to this now. I'm here in this country, and you know, working with students, as I've said, and I think there's just been a major sea change in that there's just a book out now, and many of you know Greg Mortensen and 3 Cups of Tea, and then he's done now, he's written Stones into Schools. He came to our campus last week because he was invited by the university, because they've made that book required reading for all incoming freshmen as the Common Book Program. I'm at Auburn University. I mean, you know, in Alabama. I mean, this is not, you know, the first book I would have personally picked it, but I didn't think someone else would. Because for us, I mean, this is kind of real core values and thought and working with communities. And those of you who know the book and have heard him speak, this is, again, not rocket science, as we often say. This is good common sense. But that book was on the bestseller list of New York Times for months. It's extraordinary. This is mainstream stuff now. This idea of working with communities, listening, the 3 Cups of Tea idea, you know, the whole idea now that many of you are aware that the NATO commanders in each of the various contingents in Afghanistan, it's required reading. I was talking to our ROTC guy the other day on campus, and even he's read it, you know, and he's a lieutenant colonel, and this is what he does, but he's had to read 3 cups of tea. It transformed him. I had the most amazing conversation with this military officer who is going to be out there in Afghanistan doing this. Thank God, he's going to be thinking twice and taking a deep breath first and going in, and he understands that you've got to work this way. And again, I would like to think for all of us, we kind of know that, and it's fundamentally a truth for us, but I guess I'm very encouraged because I see this now being understood more by the general population, and at the end of the day, they're the ones that are going to influence those making the public sector decisions on that for government and that, such as Jim has said.